One of the reasons people maintain their bodies is to feel sexy. It's the genesis of our confidence and self-image. After all, we're extremely sexual beings, and while it may seem like the most natural thing in the world to make babies, sometimes our complicated brains can get in the way of biology. Here to help us work through some of these issues is Mo Wilson, marriage and family therapist. So Mo, what can people expect from sex therapy?
Well, sex therapy is a form of psychotherapy. It's a mental health therapy, and it's generally tailored towards adults, individuals, or couples. And they come into the office and they talk about whatever issue, and a lot of times it's a communication issue, or sometimes it's a sexual issue if it's an individual thing, so even with couples. And basically it's a physical manifestation or a sexual manifestation of a more psychologically based problem.
Right, so it goes a lot deeper usually than just in the bedroom.
Exactly, yeah. Exactly.
What can a couple expect from sexual therapy or sex therapy?
Generally, they'll come in with their issue, and I'm going to try to help them develop goals, what they want to work on, a plan, how we're going to establish and work on those goals. I might assign homework for them, and then just a way for them to deal with these problems and kind of put them in the back and make their life the forefront.
So what are some of the problems that women tend to deal with, or issues women tend to deal with in pregnancy or in their relationships during that time?
Well, physically, as their body grows, women can start to feel changes, with the body growing, and this can be exciting, but it can also bring about, concerns about body image, which can affect your self-esteem, which can affect your happiness, and in turn, it can affect your sexuality. And then add on top of that hormone fluctuations, lifestyle change. All of those changes can really affect the relationship as well.
And what about intimacy during pregnancy?
You can have sex during pregnancy. It's a common misconception, and a lot of men are afraid to have sex with their pregnant wife or girlfriend, but it's actually very possible. Whether or not the woman wants to, though, is sometimes a completely different story. Because of the hormone fluctuations and the changing in the body, whether or not a woman wants to have sex may change from 1 minute to the next. Mm-hmm. So it's absolutely possible. Couples just need to communicate and figure out what's going on with each other and find a solution together.
What are some of the misconceptions about sex therapy?
Okay, well, a lot of people think a sex therapist will take their clothes off with you, but that's not the case. We're actually psychotherapists, and treatment takes place in an office, generally on a couch, face to face. There are different types of sexual health workers, like a sex surrogate, who is actually someone who will take their clothes off with you. And they will work on more intimate issues. There are sex coaches as well who may or may not be hands-on. So there's different types, but a sex therapist is a psychotherapist and works on mental health issues.